Now, last night, the President made one of the most important addresses in recent history. He outlined South Africa's plan to curb the coronavirus and what restrictions will be put into place. So we are joined now this afternoon by infectious disease expert, Dr. Emille Reid, to unpack exactly what went down and what this means for the country. Welcome to the show, Doctor.
Thank you.
Thank you so much for being back.
Thank you.
So last night, I think the whole country was waiting for a while for President Ramaphosa to, speak to the nation about coronavirus. Let's quickly unpack. What were some of the main points that you took from what he said?
Well, it was a speech definitely worth waiting for.
Oh, I think
that was amazing.
Yeah, he was amazing.
And I think what our president did, he owned what he said. He took leadership. Yeah. And I think the most important thing was we are going to restrict people traveling in from high-risk areas. Yeah. We're not going to allow our people from South Africa to actually travel to high-risk areas as well. Yeah. So unfortunately, those visas that are already in place is going to be revoked, and they're not going to allow any travel to any of these high-risk countries, which is amazing. Mm. Also, we're going to block people from domestic travel as well. And I think the important thing for us, we're going to need to socially distance ourselves from one another.
Exactly. What does socially distancing mean for you?
Well, usually...
what does that look like? Are you staying at home, not going out?
Well, important to know that if you have a crowded place, like a soccer stadium, like a rugby stadium, the risk of transmitting the virus is massive. So as soon as you're going to have a gathering of more than 50 or 100 people, it should not be allowed. Yeah. Because that's the breeding ground for spreading something like the coronavirus.
But what does this look like for people who are at home now? Are they not going to go to work? Are they not going to go shopping? Because I know at the moment it's a huge issue with people going panic spree buying, and I just think that's not necessary, because then there's going to be a lot of people that won't be able to get the things that they need as well when they need it. And what should that self-containment look like for people just to avoid public spaces?
Yeah. I think the important thing that we also spoke about for the last week now, is that the important thing is it's spread via droplet spread. So one need to avoid being close to other people. And I think the important people that we don't want to be close to are those people who traveled from high-risk areas and are now sharing a space with us. And if one look at the people that did test positive over the last few weeks, I think currently we're standing on a total of 63 cases. Yeah. And all of them traveled from a high-risk country. Okay. Which means that it was virus that was imported from another country. We couldn't prevent it, but now we have to contain it.
Yeah. So, you know what I've realized since I saw you last, actually, is how many times I touch my face during the day. Wow. It happens subliminally. You don't actually realize how often you're touching a surface and then you're touching your face and you're touching your mouth or you're scratching your nose. It happens all the time. But now just say you are one of those people who have traveled from a high-risk country into South Africa, or you've been in contact with one of those high-risk travelers. What does your self-isolation look like at home once you've been government tested?
Yeah, I think the important thing is people that are ill and have symptoms can shed the virus. Yeah. If you are asymptomatic, we expect a low virus load, which means that they cannot infect somebody else because they are not symptomatic.
Okay, so the symptoms is what is contagious.
Exactly.
Okay.
And the big thing associated with the symptoms is what we call viral shedding. Yeah. And that is what comes through our saliva, through our sputa, etc. And if there's no viral shedding, you cannot spread the virus. Okay. So if we are in contact or been in contact with somebody from a high-risk area, they're asymptomatic, they've been cleared. Yeah. I mean, we know that the chances of transmitting something you don't have is is zero.
Yeah, is zero. Okay, but what does that look like? If it's, because then the way you made it sound now sounds like it could be quite difficult to actually get it, unless somebody spits in your mouth or unless you exchange, unless you kiss somebody.
Secretions.
But then how are children getting it? Is it the thing, like if I lick my hand and if I touch the couch and then a child then touches it and then touches their mouth, is that then going to...
Well, it should happen almost immediately.
Okay.
Although we have seen that the virus does not survive for extremely long, like 4 or 6 hours, with the immediate contact of the sputum or the saliva being in touch at that moment in time, and you immediately come and touch it, there is a risk if that person is infected.
Okay.
If that person is not infected, there's no risk.
Then I read the most devastating thing, and I want everybody at home to please do take special note of this, is, there was a post saying that a lot of people are taking their pets to the SPCA and various other places because they're concerned that either their pets or they can get coronavirus from their pets, and that is absolutely not true. Please let us know about the infection rate with pets.
I think it's absolutely unproven at this point.
Yeah.
And where it comes from is, you remember the first coronavirus outbreak called SARS actually had its origin in cats.
Okay.
And with the second outbreak of coronavirus infection, which was MERS, the Middle East countries, the originator animal was the camel.
Yeah.
So people at this point in time, we're not sure where this coronavirus started, whether it was a dog, whether it was a snake, whatever. Hence the reason for people to believe it might be the dogs being the carrier of these coronaviruses.
Right.
Because animals frequently get and are carriers of coronaviral disease.
But your animals are safe in your homes with you.
Exactly.
They are not harming you.
Exactly.
Please do not make any radical decisions with your pets at this time. So let's just recap. I know we discussed this last week, but it is really important. Should you be coming into South Africa from a high-risk country, you go home first, then get tested from home, because I know there's also another scam happening at the moment where people are coming to your house saying that they're government officials and then scamming you and robbing you, that they want to test you. So let us know what the system is and what the practice is in place.
I think the important thing is you should not go to a hospital environment where there's a lot of other people you can infect.
Yeah.
The best thing is to contact the number that we're going to share with the viewers as well, and you inform them of where you've traveled from, and they actually go through a few questions they ask you, and then the decision is made to test you.
Okay.
So they will come or arrange with where they're going to meet you. They come and test you, and you are then self-quarantined until the results are available.
Yeah.
And again, that is a process that is taken. And I've heard numerous scams where people are doing finger prick testing, and it's not true.
Okay.
The only real test is either a pharyngeal swab or a sputum that we send for what we call a PCR. And a PCR is looking for the genetics of the specific virus.
Why 2 weeks? Like why, if you're going to be incubated, why is it 2 weeks?
Yes. Normally we find that people that are infectious, they sort of take roughly between 2 and 14 days in order to shed that virus.
Okay.
And we've seen it now with a few cases in Nigeria, where they had follow-up tests conducted, and after about 12 to 14 days, their viral shedding went down to 0, and they were no longer infective anymore. So the reason for 14 days of quarantine is because after that 14 days, you are no longer shedding the virus, and you cannot spread the virus at all.
Thank you so much for being here, Doctor. So, of course, the info line on any information that you need, if you need to be tested, is on screen right now. But I think the important part to remember is do not panic. Do not go and feel like you need to load your kitchen up with bully beef and toilet paper and all the rest. Just exercise a lot of caution, clean your hands, sanitize everything around you as much as possible, and avoid contact with people that may have traveled from high-risk countries in the recent time. Thank you very much for being here. Stay safe.
Pleasure.
I'll bury you just now.